All right, what I'm getting ready to show you now is a CNN special report that I viewed, and it's the 25 most medical mysteries and the empowered patient. So here we go. This is the best way I can illustrate to you what's going on.
From forgotten tools and an operation on the wrong side to tests that cause bald spots.
Here, boss. I have a perfect ring around my head.
And metal deadly close to a magnet. We're counting down my list of 25 shocking medical mistakes.
Mistakes are happening every day in every hospital in the country that we're just not catching.
It's the third leading cause of death in this country.
For the most part, we're silent on it.
What you can do to not become a victim. I'm Elizabeth Cohen. I'll show you how to become an empowered patient. With the help of world-renowned patient safety expert Dr. Peter Pronovost, American Cancer Society Chief Medical Officer Dr. Otis Brawley, acclaimed medical fiction author Dr. Abraham Verghese, and more. Stay tuned. This hour could save your life.
And you bear with me to the one about concerning my situation.
It's really concerning. Nobody ever thinks that they're going to go into
Closed captioning brought to you by InventHelp. Call 1-888-909-4332.
People ask me all the time, George, what do I do with
5. At number 4, infection infestation.
Here we go.
Skydiver Josh Nahum parachutes to Earth. The landing goes badly. Josh's leg breaks. His skull fractures. He's on the mend in the hospital when he catches an infection from the hospital.
Nobody ever thinks that they're going to go into a hospital only to be made more ill.
Doctors are powerless to fight the bacteria raging through Josh's body.
What we're seeing now, and it's really concerning, is there's a growing list of gram-negative bacteria that are resistant to many, if not most, antibiotics. And we have no drugs to treat these patients with.
Josh dies at 27. Here's one way infections spread.
One patient may have an infection and a nurse or a doctor is caring for both of them. I go in and I examine them or I touch them and my hands get contaminated. I then don't wash my hands and go talk to the second patient or examine the second patient. And I introduce that infection into that second patient. And in many senses, we're no different than a mosquito causing malaria. We're, a vector introducing harm rather than protecting patients.
Another way, a needle pierces dirty skin.
Your skin is an amazing defense against bacteria. But when I break that skin, I allow bacteria to enter.
Hospitals kill 75,000 people a year with these infections.
That's from the CDC. That source is from the Center of Disease Control. I guess I'm number 74,999 last
year. A year with these infections. It may be uncomfortable to ask, but make sure doctors and nurses wash their hands before they touch you, even if they're wearing gloves.
And one more, and I'll be able to do the rest of my presentation.